You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Today, what I would like to talk to you about is medications that you can buy at the drugstore or at the supermarket, essentially what we call the over-the-counter drugs. Now, I'm always questioning how much I should discuss this when I give lectures to the general public or even in this type of setting, because I'm more comfortable sitting down with a person in front of me as a patient and having access to them, their medical records, their medication list, and their laboratory tests, so I can then tell them which medications may or may not be safe for them to take. So with that caveat, it's extremely important if you're using medication, even if they're over-the-counter medications, to double-check with your doctor and make sure that those medications are safe for you. Now, the reason that I bring this up, and I think it is important to talk to patients about, is that I see a lot of people that come in and actually are making mistakes on their own with their choices of these over-the-counter medications. So, for example, you'll see patients that are on blood thinners, and they're under the impression that because they're on a blood thinner that they're not supposed to take Tylenol, but they should be taking an anti-inflammatory like ibuprofen. And it's actually the opposite. Or you'll meet people with liver disease that have been told by their doctor to not take Tylenol, and they've forgotten that or misconstrued that, so they're only taking Tylenol and not an anti-inflammatory. So depending on your liver, other medications, your kidney function, history of ulcers, other issues and that you might have, there may be medicines that you should or should not take. So definitely talk to your doctor and verify that what you're taking is the appropriate drug for you. And I've always been a believer of the philosophy that less is more. There's no need to take medicines on a regular basis. I do meet people that, they've been taking naproxen twice a day for 5 or 6 years, and they've never really had a holiday. So your chances of having a potential side effect definitely go up with the longer duration of use that you have of these medications. So let's just briefly go into what the different options are. So you have acetaminophen. So acetaminophen is the generic name of Tylenol. So Tylenol is acetaminophen, same drug. And this typically comes in 3 different strengths. You can have the regular strength, which is 325 milligrams. You can have the extra strength, which is 500 milligrams, or you can have what's commonly called the arthritis strength, which is 650 milligrams. Now, the old top dose used to be around 4,000 milligrams a day, so that was 8 of the extra strength tablets. And they came back and lowered that to 3,000 because a lot of people didn't know that a lot of the common narcotics, things such as Vicodin, Norco, Percocet, all had acetaminophen in them. So that first number with those narcotic pills, the 5 or the 7.5 or 10, is the amount of milligrams of the narcotic, the opioid. That second number behind the slash is the amount of Tylenol or acetaminophen. So you would have patients that were taking Norco or Percocet, and then they would additionally take more acetaminophen, and that was leading to a greater than 4,000 milligram dose of acetaminophen per day, which put them at risk of liver damage. So when you talk about acetaminophen is a good pill for controlling pain. It's always also been known as a good fever reducer, but we're talking about knee pain and knee arthritis, so it's good for pain. Now, the other options that you can buy over the counter that are marketed for the same types of problem, pain, but also inflammation, are the NSAIDs. These are non-steroidal anti-inflammatories. So these most commonly are known as ibuprofen, which is the generic name for Motrin or Advil, and these typically come in 200 milligram tablets. You can also get naproxen, which is the generic name for Aleve, which typically comes in 220 milligram tablets. Now, you can get prescription ibuprofen, which typically comes in 600 or 800 milligrams. Most studies have shown that the best anti-inflammatory benefits are at 600. There's not much more benefit at 800, but you're taking a larger dose, so that may increase the risk of side effects. And the naproxen prescription dose typically comes in at 500. So if you're taking these anti-inflammatories, these are going to be good for pain, but they're also going to help reduce inflammation. Now, the reason that places like Baskin-Robbins have multiple flavors is that because most ice cream is really, really good, but each of us has a particular flavor that we prefer. And that's the same thing when we come to the anti-inflammatories and acetaminophen tablets that you can buy over the counter. A common question is, well, which is the best? And there are studies that have been done that have showed that this is superior to that, or this pill is better than that one. But when it comes down to it, really, it's a trial and error for the individual. And I always stress to my patients that it's not unreasonable to swap around over time, because sometimes you may develop some sort of tolerance to one drug if it's the drug that you've always gone to for years when you have a flare-up. And you may find some other medicine at one point in time is more effective. And the other important thing that I like people to know, and I really want to stress this, is that one pill doesn't do it. So I hear commonly when patients come in that they're looking forward to invasive procedures like surgery and injections because they don't believe that pills have helped them. And it's possible that pills may not help them, but they're making that judgment or that assessment based on they took acetaminophen once or they took ibuprofen once. So the analogy that I like to use there is just like an antibiotic. So if you saw your primary for an infection, nobody goes home and takes one pill of the antibiotic and expects to be better. They would never call the doctor's office later that afternoon and say, your antibiotics don't work for me, I'm still sick. Because you know that you start them today and 2 or 3 or 4 days later, as that medicine kicks in, it builds up to effective blood levels to do its job to treat the infection, you start to feel better. And it's the same thing with medications that you can buy over the counter for knee pain, is that if you take them when needed and you take them in a series of doses over a few days, what you'll see is those symptoms and those pains will then start to go away most commonly. So definitely look at this as not a one-time, one-pill treatment, but you may need to take this for a period of time. But again, the longer you take any medication over a period of time, the greater the risk of developing complications or side effects. So the least amount that does the job is the best amount. So what about dosings? And this is where I always am a little cautious when I'm talking to big groups and giving lectures, because again, you really need to discuss these dosings and options with your doctor. But I believe it's important at least to go over and talk about what common options are for my patients that I see that don't have any risk factors or medications such as blood thinners that would be contraindicated to take with anti-inflammatory. So for acetaminophen, what I'll typically have most of my patients do is if they have a flare-up is they'll do 2 pills twice a day for 2 days. And I always try to get things in the way of remembering things. So 2 pills twice a day for 2 days. Pretty easy to remember. Now, if that helps you, great. That was the least amount. It's been helpful. And then you can stop it. But if you still have problems, you could then increase it, taking those same 2 pills, which are the 500 milligrams, the extra strengths. So you're getting 1,000 milligrams at a time. So 2 pills twice a day for 2 days wasn't effective. So now let's increase it to 2 pills 3 times a day for 3 days. And usually at that point, you've been taking this for 5 days. Usually that drug's going to be helpful if the Tylenol was going to be effective. So this would be great for people that have ulcers, kidney disease, or on blood thinners. Acetaminophen is going to be the drug of choice because there's no risk of bleeding and shouldn't affect the kidneys. Now, what about patients that can take anti-inflammatories? So again, not a best. There is no best anti-inflammatory, ibuprofen or naproxen. I just have some people that will respond better to one drug than the other. So when it comes to ibuprofen, I always do my rule of 3s. So ibuprofen, best anti-inflammatory benefits, typically around 600 milligrams. So that would be 3 of the over-the-counter pills. But again, if you have a prescription for 600 milligrams, that is the equivalent of 3 over-the-counter pills. So if you say take 3 pills 3 times a day for 3 days, that's not 3 of the prescription strength. That would be way too much medicine. So 3 of the over-the-counters, So they're 200 milligrams each, so 600 milligrams with breakfast, lunch, and dinner. This way you're taking it with some food for 3 days. And usually that 72-hour window is enough to reduce inflammation. You can take it for up to 5 to 7 days. But again, if that medicine's not helping after that duration of time, there may be something else going on, or that medicine may not be effective for you. So the other anti-inflammatory option would be naproxen. And typically I'll have my patients do the 2 pills. So again, they're 220 milligrams. So you're getting a total of 440. And the typical prescription dose is 500. So you'll take 2 over-the-counter pills twice a day with breakfast, with dinner. And then what you should do is for 2 to 3 days. And again, if you're still having symptoms, you can increase this for 5 to 7, but then stop and then reassess your symptoms. So that's the first line. You've had pain, simple things like ice, braces, exercise haven't helped. You need a medicine. Here you go. You have your options of acetaminophen. You have your options of ibuprofen or naproxen. Now remember that anti-inflammatories, ibuprofen, which is Motrin and Advil, and naproxen, which is Aleve, they're all anti-inflammatories. So if you have pain, and I've seen people make this mistake, I was taking ibuprofen and I still hurt, so I also took Aleve. So you're taking 2 anti-inflammatories. Although they're different, they're the same class of drugs. They have the same risks and the same potential side effects. You're doubling the chance of having a stomach ulcer or a bleeding problem or a kidney problem. That being said, we will always say that 1 + 1 = 3. And that means that when you combine a medicine like acetaminophen with an anti-inflammatory, you get better effect than either one alone. So it affects the pain receptors that acetaminophen will help, and it also affects the pain receptors and the inflammation issues that you get with anti-inflammatories. And it's a common thing that we use after surgical procedures to limit the use of narcotics. So if I have someone that has severe acute pain, I get a phone call or a message from a patient that's on vacation that tweaked their knee and they can't come in for a cortisone shot, and they know they didn't fracture it, but they're really, really hurting. A great option would be taking the 2 acetaminophen, and you can take this 3 times a day along with one of the anti-inflammatories. So dosing 1 would be 2 of the acetaminophen tablets. These are 500 milligrams with 3 of the ibuprofen tablets, which is 200 milligrams for a total of 600. And you take those 5 tablets 3 times a day. Yes, it's a lot of medicine, but for an acute pain episode, this would be something that you could try doing for 3 days, and then the symptoms should go away. The other alternative, if you had naproxen, which is Aleve, you could do 2 acetaminophen, 500 milligram tablets each for a total of 1,000, with 2 of the naproxen, taking that twice a day. And again, for about 3 days, that 72-hour window should bring symptoms down. So there you go. There you have it. It's just a little bit of information about the over-the-counter drugs that you can buy at the store. And again, I caution you to be cautious when using these medications, because even though that you can buy them over the counter, they do have side effects and they do have risks. So if you are going to use these, be sure to check with your healthcare provider to make sure that the particular drug you're planning on taking is safe for you and your health conditions and the medications that you're on. But I do think this is important because I meet lots of people that come in that were taking an anti-inflammatory while they were on a blood thinner, or they were taking 2 anti-inflammatories, not realizing that they were of the same class of drugs. So hopefully you found this information helpful. Please subscribe so you'll be aware when new episodes come out. And if you found this information helpful and you know somebody that you think would also benefit from this information, please share this podcast with them. You've been listening to the Your Knee, Your Health podcast. I'm Adam Rosen. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.